Hi. When you start studying about leadership, you might be thinking, I am just beginning my career in nursing. How can I be expected to be a leader now? But please keep in mind, leadership should be considered a dimension of nursing practice and it should begin during the student period. Strong leaders in nursing are vital to help navigate the constant evolution of healthcare. The topics which we will be discussing in this video are powerlessness in nursing, different types of power in nursing leadership, leadership theories and styles, and followership. We cannot study leadership theories without knowing what is power and powerlessness. Powerlessness in nursing, a situation where nurses perceive themselves as lacking control, influence, or autonomy within their work environment, which can lead them to a feeling of frustration, demoralization, and decreased job satisfaction. Demoralization in the sense they will lose their confidence in being a good nurse. There are certain factors that lead to powerlessness in healthcare organizations. Why we nurses are considered powerless. The first point is the hierarchical structure. Traditional hierarchical structures in healthcare organizations can contribute to feelings of powerlessness among nurses. Nurses may perceive themselves as having limited influence or voice in decision-making processes, particularly when decisions are made by higher-ranking administrators or physicians without input from frontline nursing staff. The second factor that leads to powerlessness is the limited autonomy. There are constraints on nurses' ability to make clinical decisions, implement evidence-based practices, and advocate for patients. That can undermine or they can erode the sense of professional autonomy and efficacy of nurses. We are being taught about critical thinking, clinical decisions, evidence-based practice and being patient advocates. But how much we are able to do that? That is because of the limited autonomy our profession is having. Nurses may feel disempowered when they are unable to provide optimal care or address patient needs due to organizational constraints or policies. The third factor is resource constraints. Resource constraints such as inadequate staffing levels, limited access to essential supplies and equipment, and insufficient support services can contribute to feelings of powerlessness among nurses. When nurses are unable to provide safe and effective care due to these resource shortages, they may experience frustration, burnout, and a sense of powerlessness to enact meaningful change. The fourth factor is interprofessional dynamics. Power differentials between nurses and other healthcare professionals, such as physicians, administrators, or auxiliary staff, can exacerbate the feelings of powerlessness. Nurses may perceive themselves as having less influence or status compared to other healthcare professionals, which can impact their ability to advocate for patients, collaborate effectively in interprofessional teams, and assert their professional expertise. The fifth factor is organizational culture. Organizational cultures that prioritize hierarchy, top-down decision making, and compliance, that means following only the guidelines and commands over the collaboration, shared decision making and empowerment all can perpetuate the feelings of powerlessness among nurses. A culture that does not value nurses' contributions, input, and perspectives can undermine or again erode their sense of professional identity and agency. The sixth factor leading to powerlessness is workplace stress and burnout. Nurses who feel powerless to address patient care challenges, advocate for changes in their work environment, or who are powerless to voice concerns about the workplace issues, they may experience emotional exhaustion. Depersonalization, that means they may lose their individuality as a nurse, and reduced personal accomplishment, contributing to burnout and attrition. So, how to address the powerlessness in nursing? Organizational commitment should be there to promote a culture of empowerment, shared decision making, and professional autonomy. Fostering interdisciplinary collaboration, providing opportunities for nurses to participate in decision making processes, investing in resources to support nursing practice, creating supportive work environments that prioritize staff well-being and engagement. So, we have to reduce these feelings of powerlessness and enhance the nursing satisfaction. Then only retention will be there and quality of care we will be able to provide. So, this is about powerlessness in nursing. Nursing leadership is the ability to inspire, influence, and motivate nursing staff and other healthcare workers to work together to achieve their highest potential and collective organizational goals. So, this is the definition of nurse leadership. Leadership we cannot learn without knowing what is power. Power is a fundamental aspect of nursing leadership, influencing how the leaders interact with others, how the nurses make decisions and achieve organizational goals. When we are talking about power, we need to know about what are the different types of powers a nurse can have. First is legitimate power. It is derived from a leader's formal authority within the organizational hierarchy because of the position. Nurse leaders hold legitimate power by virtue of their positions, such as nurse managers, directors, or executives. They have the authority to make decisions, allocate resources, and influence the actions of others based on their positional authority. The second type of power is expert power. That stems from a leader's specialized knowledge, skills, and expertise in nursing practice, clinical area, or specific areas of healthcare. So, because of the expertise the leader is having, expert power they have got. Nurse leaders who possesses advanced degrees, certifications or extensive clinical experience may wield expert power and influence others through their credibility, competence and ability to provide expert guidance and direction. The third power is referent power. It is based on the personal qualities, charisma and likability of the leader. How much likable the person is, that is what the referent power is. Nurse leaders who are admired, respected and trusted by their followers can exert referent power by inspiring loyalty, fostering collaboration, and building strong relationships based on mutual respect and admiration. Next power is reward power. It involves the ability of a leader to provide rewards or incentives to motivate and influence others. The leader is able to provide some rewards to the followers. Nurse leaders may have the authority to grant promotions, bonuses, or other forms of recognition as rewards for performance or achievement. Reward power can be used to reinforce desired behaviors, encourage compliance, and motivate staff to achieve organizational objectives. The fifth power is informational power. It is derived from a leader's access to valuable information, data, or resources that others need or rely on. Nurse leaders who possess critical information, insights, or resources can leverage informational power to influence decision making, shape perceptions, and guide organizational strategies. Informational power is particularly relevant in healthcare settings where access to accurate and timely information is essential for clinical decision making and patient care. Coercive power. This is not a good type of power, we can tell. It involves the use of threats, punishments, or negative consequences to influence the behavior of others. Nurse leaders may employ coercive power to enforce compliance with organizational policies, address performance issues, or mitigate risk to patient safety. While coercive power can be effective in certain situations, it can also erode trust and undermine the morale if used excessively or inappropriately. So these are the different types of powers. Leaders in nursing inspire and influence others to achieve their maximum potential. If you want to be a leader, you have to act on your idea. Leadership occurs whenever one person attempts to influence the behavior of an individual or group, up, down, or sideways in the organization, regardless of the reason. It may be for personal goals or for the goals of others, and these goals may or may not be congruent with the organizational goals. Thus, leadership is influence, and it may or may not be congruent with the organizational goals. There are three important competencies for a leader. One, they should be able to diagnose a situation. And second, they have to make changes or adapt. And the third one, they need to communicate. What makes a person a leader? Or we are going to see the different leadership theories. At this point, I would like to tell you one thing. Leadership styles and theories are related concepts, but we cannot tell they are synonyms. Styles means the specific behaviors or approaches which are exhibited by the leaders, and these leadership theories are the frameworks or model or the theoretical explanations. There are n number of theoretical theories related to leadership, but here we are going to discuss just a few. First one is trait theory. It suggests that certain innate qualities or traits predispose individuals to become effective leaders. There are some innate qualities for a person. Trait-based approaches to leadership focus on identifying and studying these personal characteristics. It can be intelligence, confidence, decisiveness, or settling up of an issue and producing some correct results. That is what decisiveness is. And integrity. These are all associated with effective leadership. These leaders communicate a sense of goal direction that will attract followers. Leaders communicate the meaning and purposes of their goals. The leaders demonstrate trust, an important thing. They demonstrate reliability and consistency. These leaders know themselves well and work within their strength and weakness. So this is about the trait theory. The second theory is behavioral theory, which focuses on what the leader does. There are three types of behavioral theories: autocratic leadership, or directive or controlling or authoritative leadership. The second one is democratic or participatory leadership, and the third one laissez-faire or permissive or non-directive leadership. So we can see the comparison of autocratic, democratic and laissez-faire leadership through this table. The first based on the amount of freedom. In autocratic leadership, the leader gives order. That means little freedom is there. In democratic, it is moderate and the freedom is very much high in laissez-faire. The amount of control, on the other hand, in the autocratic, it is too much high. Democratic, it is moderate, and in laissez-faire, very little control over the followers by the leader. Decision making. In autocratic, the decisions are made by the leader. In democratic, both leader and the group make the decision. And in laissez-faire, the decisions are taken sometimes by the group or nobody will be taking any decision. The leader activity level is high in both autocratic and democratic, and it is minimal in laissez-faire. The assumption of responsibility in autocratic is on the head of the leader. It is shared in democratic and it is not at all there or abdicated in laissez-faire. The output of the group is high and of good quality in the autocratic. Since the decisions are by leader and group both, that is creative output and high quality can be obtained in democratic. And laissez-faire, the output is variable. It may be of poor quality. If we are seeing the efficiency, the autocratic leadership is very efficient, but it may reduce the team members' motivation because the freedom is not given too much. In democratic, it is less effective compared to autocratic, but it increases the motivation and creativity of the members. The laissez-faire type of leadership is inefficient. So these are the three types of leadership styles in behavioral theory. Task versus relationship focused leadership. Some nurses emphasize the task and they fail to recognize the interpersonal relationship, and it will affect the morale and productivity of the employees. The task means the nurses will be thinking about administering medications, completing the patient's records. And the interpersonal relationship here we means the attitude of physicians towards nursing staff, or the treatment of housekeeping staff by the nurses. So that is given less importance. But some other nurses focus on those interpersonal aspects and ignore the quality of the job being done. The most effective leader is able to balance this task and relationship. Motivation theories. There are three historical motivation theories, namely Maslow's theory, which includes 5 needs, Herzberg's theory, it's also known as two-factor theory, and McLean's theory, that is, there is 3 dominant needs in workplace. The first theory in motivation theory is Maslow's hierarchy of needs, which you all know. The lower order needs are the physiological needs, then come safety, security, love and belongingness, self-esteem and self-actualization. So this Maslow's theory is based on categories of needs. Lower needs must be fulfilled before the higher needs. So here the leaders try to fulfill the needs of the employees or the followers. The second theory by Herzberg is known as two-factor theory that influence motivation. They are the hygiene factors and the motivators. The hygiene factors include company policy, supervision, interpersonal relationship, working conditions, and salary. And motivators include achievement, recognition, the work itself, responsibility, and advancement in the job. The absence of hygiene factors can create job dissatisfaction for the followers, but their presence does not motivate or increase satisfaction. So that is about Herzberg's two-factor theory. Then comes McLean's theory. Motivation results from 3 dominant needs. These 3 needs are need for achievement, that is performing the task on a challenging and high level. The need for affiliation, that means having a good relationship with others. And the need for power, that is being in charge. Emotional intelligence theory. Sometimes you might have heard some leaders or some people can be called as stars in their leadership. It is because of their emotional intelligence. Emotionally intelligent leader recognizes and understands his or her own emotions. When a crisis occurs, he or she is able to manage them, channel them, stay calm and clear-headed, as well as they suspend the judgment. They will not take any judgment until all the facts are in. The emotionally intelligent leader welcomes constructive criticism, asks for help when needed, can handle multiple demands without losing focus, and they can turn problems into opportunities. The emotionally intelligent leader listens attentively to others, recognizes unspoken concerns, acknowledges others' perspectives, and brings people together in an atmosphere of respect, cooperation, collegiality, and helpfulness so that they can direct their energies towards achieving the team's goals. Situational theories. Situational leadership theory proposes that effective leaders adapt their leadership style to the specific needs and characteristics of followers and the situational context. Situational leaders assess the readiness and competence of followers and adjust their leadership behaviors accordingly, ranging from directive and task oriented to supportive and relationship oriented approaches. Adaptability is the key to the situational leadership approach. They are adaptable. to the situations. Followers' readiness level range from sometimes they may be unable, unwilling, and insecure. And the leaders with their situational leadership quality, they make the followers to able, willing, and confident. The leader's behavior will focus on appropriately fulfilling the followers' needs, which are identified by their readiness level and the task. Leader behaviors will range from telling, guiding, and directing to delegating, observing, and monitoring. I would like to tell an example. Where did you fall in the model of situational theory when you had your first clinical posting? And compare it with now at present where you are. In the beginning, of course, the teacher or the clinical instructor had to give you clear instructions. They had to clearly observe you and guide you and direct you. But now, those clinical instructors or teachers or the seniors will be delegating and they will be just observing and monitoring you. Likewise, you also, when you are becoming leaders, train and teach the new nursing students, guiding and directing them. Next is transformational leadership. Transformational leadership focuses on inspiring and motivating followers to achieve the higher levels of performance and personal growth. Transformational leaders articulate a compelling vision, foster innovation and creativity, and empower followers to reach their full potential. They often exhibit charisma, vision, intellectual stimulation, and individualized consideration. So, in transformational leadership, the meaning, inspiration, and vision are the distinguishing features. This theory emphasizes that people need a sense of mission, a vision should be there that goes beyond good interpersonal relationships or an appropriate reward for a job well done. We should have a good mission in front of us. Caring for people, sick or well, is the goal of our profession. Most people also chose this profession in order to do something for the good for humankind. So that is a vision. Our responsibility in nursing leadership is to help the nurses see how their work helps them achieve their vision. Transformational leaders can communicate their vision in a manner that is so meaningful and exciting that it reduces negativity and inspires commitment in the people with whom they work. These leaders have imagination, creativity, planning, persistence, audacity, and courage. A great leader shares his or her vision with his followers, and the goals of the leader and staff will ultimately become fused, creating unity, wholeness, and a collective purpose. Eighth is transactional leadership. Transactional leadership operates on the basis of rewards and punishments to motivate followers. Transactional leaders establish clear expectations, they set goals, and they provide rewards for performance while also applying corrective measures for deviations from if the standards are not met. This style emphasizes structured processes, accountability should be there, and the exchange of rewards for compliance. Moral leadership. involves deciding how one ought to remain honest, fair, and socially responsible under any circumstances. Caring about one's patients and one who work for you is part of moral leadership. Servant leadership. Servant leadership prioritizes the needs and development of followers above the leader's self-interest. Servant leaders focus on serving others, promoting their well-being and facilitating their growth and development. They are in the sense the followers. They emphasize or the servant leaders emphasize empathy, humility, listening and empowerment, viewing leadership as a form of service to others. Caring leadership. It comes from two primary sources, servant leadership and emotional intelligence. Servant leadership, as we have seen, chooses to serve first and lead second, making sure that the followers or people's needs within the work setting are met. Emotionally intelligent leaders are especially aware of not only their own feeling but also others' feeling as well. So caring leadership is a combination of the servant leadership and emotionally intelligent leadership. And it is mostly the follower oriented or people oriented we can. Characteristics of caring leaders. They respect their co-workers and individuals. They listen to other people's opinions and preferences, giving them full consideration. They maintain awareness of their own and others' feelings. They empathize with others, understand their needs and concerns. They develop their own and their team's capacities. They are competent both in leadership and in clinical practice. So these are the characteristics of a caring leader. Caring leadership is attractive for many nurses because it applies many of the principles of working with patients and also working with the other staff, with the interdisciplinary team also. Authentic leadership. Authentic leadership emphasizes self-awareness, genuineness, and transparency in leadership behavior. Authentic leaders align their actions with their values, demonstrate integrity and consistency, and build trust and credibility with followers. They encourage open communication, foster meaningful relationships, and they promote ethical behavior. They are authentic in the things they do. 13. Charismatic leadership. Charismatic leadership involves the ability to inspire and influence others through personal charisma, charm, and persuasion. Charismatic leaders possess a magnetic personality and a compelling vision that attracts followers and motivates them to achieve shared goals. They often exhibit confidence, enthusiasm, and persuasive communication skills. Contingency theory. Contingency theories of leadership propose that the effectiveness of leadership is contingent upon various situational factors such as characteristics of the followers, the nature of the task, and the organizational context. Contingency theories seek to identify the most appropriate leadership style or approach for specific situation to optimize the outcome. So the leaders choose leadership styles based on the situations so that they get a good outcome. Path goal theory. Path goal theory posits that Leaders clarify the path to goal attainment, how to reach at the goal, how to remove the obstacles, and provide support and guidance to help the followers achieve their objectives. Path goal leaders adapt their leadership behaviors to the needs and circumstances of the followers, aiming to enhance motivation, satisfaction, and performance by facilitating goal achievement. Leader Member Exchange or LMX theory. Leader Member Exchange theory emphasizes the importance of quality of relationships between leaders and individual followers. LMX theory suggests that leaders develop unique exchange relationship with each follower. It is characterized by mutual trust, respect, and reciprocity. In this leader-member exchange theory, there are two groups we can tell, in groups and out groups. The leaders form in groups and it will result in high quality exchange. In group means the leader gives more information, influence, confidence and concerns towards their subordinates, and the followers are more dependent and highly involved in this type of in groups. And in out groups, the followers are not that much compatible with the leader and they just come to work, do their job and go home, so the quality is quite low. Quantum leadership in nursing. This is a contemporary style of leadership which now we can adopt. It emphasizes a dynamic, interconnected approach to leadership that acknowledges the complexity and uncertainty inherent in healthcare environments. There are 5 types of quantum leadership. The first one is the wave leadership or adaptive. Wave leaders in nursing adapt their leadership style based on the ever-changing needs of the patient, staff and healthcare environment. There is a adaptive relationship in this wave leadership. They are flexible, innovative and responsive to dynamic situations. For example, a nurse manager may adjust staffing schedules and resource allocations in real time to accommodate the fluctuations in patient census and acuity levels. So they are able to adapt in this type of quantum leadership. The second quantum leadership is particle or holistic leadership. The particle leaders in nursing provide stability and direction to their teams. They have a clear vision, establish goals, and implement structured processes to achieve organizational objectives. An example of particle leadership is a nursing director who implements standardized protocols and best practices across multiple nursing units to ensure consistent quality of care. So we should move to this holistic or this particle leadership. The third is observer effect leadership or transformational leadership. Observer effect leaders in nursing recognizes the influence of their presence, actions and communication on their team's performance and morale. They lead by example, demonstrating integrity, empathy and authenticity in their interactions with staff and patients. For example, a nurse leader who actively engages with frontline staff, listens to their concerns and provides meaningful feedback can positively impact the staff morale and job satisfaction. So the observer effect leadership, they influence the followers by the presence and actions and communication. Fourth one is uncertainty or complexity leadership. Uncertainty leaders in nursing navigate ambiguity and complexity with confidence, adaptability, and resilience. They embrace uncertainty as an opportunity for growth and innovation, encouraging the staff to explore new approaches and solutions. An example of uncertainty leadership is a nurse executive who leads their organization through a major transition, such as implementing a new electronic health record system by providing support. So the nurse will provide support, resources and guidance to staff during the change process. That is complexity leadership, or when uncertainty time comes, this leader will come to action and will support the followers. Fifth one, entangled leadership or relational leadership. Entangled leaders in nursing emphasize the interconnectedness of healthcare professionals and the importance of collaboration and teamwork. They foster strong relationship among nurses, physicians, allied health professionals, and support staff to enhance patient care outcomes. For instance, a nurse leader may facilitate regular multidisciplinary team meetings to coordinate care plans and address complex patient needs collaboratively. So this is a collaborative approach, relational or entangled leadership. So these are the different theories of leadership in nursing. Now moving to the styles of leadership. In the very beginning itself, I told this leadership styles and theories are not synonyms. They are two things. The styles are the behaviors and theories are the models. So the first style a leader can have, there are different types of styles and you can have a mix of these styles also when you are becoming a leader. Adaptive, that means they are flexible, willing to change and devise new approaches. Emotionally intelligent leaders, they have the styles of, they are aware of his or her own and others' feelings. Charismatic, they have magnetic personalities who attract people to follow them. Authentic, they demonstrate integrity, character, and honesty in relating to others. Level 5, this is what I like most. Ferociously pursues goals but gives credit to others and takes responsibility for his or her mistakes. Mindful means thoughtful, analytic, and open to new ideas. Narcissistic, they don't listen to others and doesn't tolerate disagreement but may have a compelling vision. Somebody like Hitler. No excuse, mentally tough, emphasizes accountability and decisiveness. Decisiveness means they will be settling an issue and they will be producing a definite result, but they are mentally tough. Resonant, motivates others through their energy and enthusiasm. Their energy is motivating others. Servant leaders, they have the style of empathy, awareness and healing. They lead to serve others. Storyteller, they use stories to convey messages in a memorable and motivating fashion. Strength based, focuses and capitalizes on his or her own and others' talents. As a leader, we have to understand the talents of others and we need to provide the task according to their talents. Then the work will be done in a very exemplary way. Tribal, build a common culture with strong sharing of values and beliefs. So what are the qualities of an effective leader? There are certain qualities a leader should have. First one, integrity. They should be honest, law abiding and trustworthy. The leaders should adhere to both code of personal ethics and also code of professional ethics. Courage. Being a leader means taking some risk. Positive attitude. Leaders' attitude is noticed. So if they are having a positive attitude, followers will be more quickly coming to that leader's side. Initiative. To be a leader, you must not only have good ideas, you must act on those good ideas. You should initiate from your part. Energy. Leadership requires energy. It's important that the energy should be used wisely. Optimism. There are chances we will be facing difficulties and crises. So at that time, we should not be discouraged. A problem should be considered as an opportunity by a leader. Perseverance. Effective leaders do not give up easily. They are persistent. Generosity. Freely sharing your time, interest, and assistance with your colleagues is a trait of a generous leader. Sharing credit for success and support when needed are also the ways of a generous leader. Balance. Patients and colleagues and families and friends, everything is important to you. So there should be a balance between the work and play. Ability to handle stress. Coping with stress in a positive and healthy manner is very much required for a good leader. Self-awareness. How sharp is your emotional intelligence? People who do not understand themselves are limited in their ability to understand people with whom they are working. We should avoid unfair treatment based on our personal likes and dislikes. We should have a good self-awareness. Here, I would like to ask you who you are. Ask yourself, you have got a real challenge. Will you be telling when a problem comes in front of you? Will you tell, we are having a real challenge here, or oh God, this is really a problem? The second one is not for a good leader. Second, do you ask, I will give it my best? Or will you be telling, do I have to? You should never think like that. I will give my best is the statement of a good leader. That's great. When somebody does something, you have to tell that's great. You should not simply just tell that's nice, I guess. That will not be motivating. When problem comes, will you be saying, we can do it? Or, oh God, that will never succeed. You have to go with the statement, we can do it. And always go for a yes and not a maybe. Behaviors of an effective leader. The leader should not only have some qualities, they should behave also in an effective way. We need to know how a leader has to behave. Then only when you are becoming leader, you will be behaving in that particular way. Setting priorities. There are 3 E's of prioritizing: evaluate, eliminate, and estimate. Continually evaluate what you need to do. Eliminate tasks that someone else can do. And estimate how long your top priorities will take you to complete. Second is thinking critically. Careful, deliberate use of recent analysis you should have to reach a decision. The essence of critical thinking is a willingness to ask questions and to be open to new ideas or new ways to do things. Solving problems. Effective leaders help people identify the problems and work through the problem solving process to find a reasonable solution. Respecting and valuing the individuals. Each individual has different wants and needs and has different life experiences. Effective leader has to recognize these differences in people and help them find the rewards in their work that means the most to them. Skillful communication. It includes three things: listening to others, encouraging exchange of information, and providing feedback. Listening to others, it's a great thing. It involves both giving and receiving information. Sometimes some leaders fail simply because they do not listen to what other people were trying to tell them. Encouraging exchange of information means people sometimes fail to share enough information with each other. The leader has to make sure that the channels of communication are open. Third one, providing feedback. There should be effective information about the effectiveness of the performance of the co-workers. Frequent feedbacks, both positive and negative, is needed so that people can continually increase their performance. Next is communicating a vision for the future. Effective leaders has a vision for the future. Communicating this vision to the group and involving everyone in the working towards that vision generates inspiration that keeps people going when things become difficult. Developing oneself and others. Learning does not end upon leaving school. Continue learning throughout your career. Effective leaders not only continue to learn but also encourage others to do the same. Next, we are going to see followership. Leadership is not complete without a good follower. I want you to imagine a situation in which you are working in a patient care unit where from the very lower level to the upper level, everyone is willing to take an extra task without being asked, or they come back early from the coffee breaks and they complete their charting on time. They try to support and improve the patient care and they are proud of the high quality care they provide. Wouldn't it be a wonderful thing to be part of that type of team? So that is what followership is. Without a leader, the followers are doing the things. The most valuable follower is a skilled, self-directed professional, one who participates actively in determining the group's direction, invests his or her time and energy in the work of the group, thinks critically, and advocates for new ideas. How to become a better follower? If you discover a problem, inform your team leader or manager right away. Include a suggestion for solving the problem in your report. Freely invest your interest and energy in your work. Be supportive of new ideas and new directions suggested by others. Explain why you disagree when you disagree. Listen carefully and reflect on what your leader or manager says. Continue to learn as much as you can about your specialty area and share what you learn. This is how you can become a better follower. Think how much of things you are doing at present. There are situations our leaders or managers may be confusing, frustrated, or even distressing you. And how to handle these types of leaders and managers. First one, Avoid adopting the ineffective behaviors of this individual. Continue to do your best work and to contribute leadership to the group. If the situation worsens, you take the support of others on your team and you ask for a remedy. If the situation becomes intolerable only, consider the option of transferring to another unit or seeking another position. So this is known as managing up. Nursing leadership refers to anyone who positively influences other nurses and entire healthcare organizations while managing a team. Also keep in mind, manager or leader is also a human, a person with many needs, concerns, distractions and ambitions. So keep your expectations of your manager realistic and try to reduce the distance between you and your manager. Successful leaders never stop learning and growing. This is why I started this channel for you all. Who we are is who we attract. Try to become good leaders in nursing and help the progression of our profession. Thank you. Happy learning.